Hey everybody, this is Dr. Cohn. Good to see you. I'm going to be doing a little talk on some of the symptoms of heart problems and hope that you enjoy it. Please subscribe to this channel. Help me grow this channel. I'm trying to put out some good information for everybody. Give me a thumbs up. That also helps. Take a second and hit that little thumbs up thing that you're seeing. And let's get into it. I just wanted to talk about some of the symptoms of a heart that is needing some support. Why? Because it's a huge problem. I see a lot of people coming into my office with various complaints. No one usually comes into the office saying, "Oh, fix my heart." People come in all the time saying, "My shoulder's hurting," or "I'm tired." So they don't associate it with the heart. They just come in saying, "Hey, I've got a problem. Fix it. Find out what's going on and fix it, please." So I just wanted to go over some of the common lists of what I see in my office as symptoms of a heart that is needing some nutritional support. Let's start with pain. The heart is king of making aches and pains. It seems to have some connections throughout the body. Since the heart is in your chest, you might think, oh, having some pain in the chest, it would be where you feel the pain. And surprisingly, I was like, it doesn't seem like that's the most common place where people feel pain. If the heart is hungry for some nutrition, it's frustrated, angry, I'm starving, give me something. I do find a lot of people, not sure if it's showing on the video correctly, but this is my left shoulder. A lot of people say that they just have some left shoulder pain for no reason. Or it's also possible to have some right shoulder pain, just less common. People start to say, hey, my fingers are numb, um, or I'm having some elbow or arm pains, and then they blame it on whatever sport they're doing, or they blame it on the fact that I type, I play golf. Oh, I've got golfer's elbow. I play tennis. Oh, I've got tennis elbow. Probably not. You probably have the heart, which is associated with that zone, affecting that zone, and then because you're using it, it hurts a little bit. But stopping your favorite sport, or I'm going to stop typing because my hands hurt. That's not a real solution. The solution is you've got to find out where that stuff's coming from. Very frequently, it's coming from the heart. So hand pain, hand numbness, pains going down the arms seems to be more common on the left side. Um, it can be associated with snoring. If the heart is lacking some nutrition, it seems to affect some of the deep musculature of the breathing and the passageway in the throat. Seems to be involved with just generally feeling kind of tired. Don't feel like going to play sports. Just kind of exhausted. I'm forgetting the back can be involved. People can have back pain. People can have pain going down their legs as well from the heart needing some nutrition, needing spine care, chiropractic care a lot. And then if you fix the heart, whoops, don't need chiropractic care all the time. My spine has quit being spasmed all the time. So a lot of pains just clear up when the heart gets the correct nutrition. Um, a lot of times people have symptoms mostly on the left side. They'll say, got left shoulder pain, hand's been giving me trouble on the left side. Oh, my back's hurting, more on the left side. Oh, my left knee's hurting. And when I hear people saying a lot of left-sided stuff, then I'm really suspicious of the heart. Um, so fatigue, feeling like you're getting out of breath when you're walking upstairs. Um, Not wanting to exercise just because you feel like it takes too long to recover, just like you've lost your momentum. I just don't really want to go do much. Those are some of the things that I see a lot. Um, a lot of stuff related just to energy, tired, um, aches and pains. Oh, another thing, a lot of the heart symptoms seem to be worse, strangely, at night. So people have trouble sleeping comfortably. They seem like they can't get comfortable. A lot of leg movement, restless leg syndrome, um, uh, just feeling like you're more aware of some of the pains at night, but in the day you weren't really thinking about them too much. So things worse at night. That's a common heart symptom. For men, some men can have some erection troubles. Why? The heart is the pump. The heart is the pump for the blood that gives a man an erection. So ED, erection dysfunction, always goes back to the heart. So that can be a big deal for some guys. Generally, it starts to happen to guys sometime middle age and older, about the time that the heart has been ignored for long enough that it's starting to have some issues. And it doesn't always correspond with, um, oh, you have a dysfunctional EKG, or that we did an MRI, we found that you had a heart attack. Doesn't mean that type of stuff. It could be everything looks fine. Excuse me. Everything looks fine according to the medical doctor, but there's some nutritional or functional problems going on with the heart. That's different. So, excuse me. Also find a lot of athletes having trouble being at their best. If they're competing in some sports, they're just not doing good. They're like, I was doing good last year, but this year I suck. And we check, and it's the heart. The heart is missing some nutrition. It's actually very common for athletes to have nutritional deficiencies for the heart. When I do the applied kinesiology and we find that the heart has a reaction and the heart is needing something, the athletes usually get a little bit, a little bit offended, because like, I work out my heart. I have a low heart rate. I have a very fit heart. Yes, you do. And you burn through a lot of your nutrition when you're doing your sports and you're running or you're cycling or you're swimming or whatever it is that you do. You exercise your heart more than usual. You need to have the supplements for your heart more than usual. Are you taking the correct supplementation for your heart? Well, I don't know. I'm trying to, maybe take some general stuff. What frequently has happened is particular athlete will be low on one or two or three or many micronutrients because they exercise their heart, and then that heart uses up those micronutrients in the intense training and competitions that they do. We find out what those micronutrients are, their performance just goes right back up to the awesome level. So if you're like really not doing well at your sport and you used to do it, it's very common that there's a heart issue. Not heart disease. That doesn't mean you have an impending heart attack or your heart's about to explode. No, it just means that there's something that's missing for your heart for performance and for it able to do the job as well as it can. So that's a general overview of some of the things I see with the heart. I'm probably forgetting a few, but the heart is very involved with mysterious aches and pains for no obvious reason, troubles worse at night, kind of low level fatigue, sports performance issues that are unexplainable, a lot of symptoms on the left, a lot of symptoms in the hands and arms. So hope that is eye-opening for you. If you know someone who has some of those symptoms, share this video with them. And maybe I can meet you someday, or you can email me or call the office. I'd love to help. If you're having some of these symptoms and you're nowhere close to me, try asking someone who can do some functional medicine type tests for your heart, because it's very likely behind some of your mysterious complaints that are not getting better. Hope this is eye-opening for many people, and I'll see you on another video.